Is masturbation harmful for men over the age of 70? The simple answer is no. In fact, for many older men, masturbation can remain a healthy and natural part of life. However, the more interesting questions are these. Do men still desire sexual activity after 70? How common is masturbation in older age? What role do erectile dysfunction and heart health play? And can maintaining sexual activity actually benefit long-term health and function? These are important questions because sexuality in older adults remains a surprisingly misunderstood and under-researched topic. Society often treats sexuality in older age as taboo or even non-existent, despite the fact that sexual interest and behavior continue well into advanced age for many people. One thing we must understand from the beginning is that aging affects every biological system in the body. Muscle strength declines, reaction times slow, metabolism changes, and hormone levels decrease over time. Human sexuality is no exception. Sexual desire and sexual function naturally decline with age, and this is completely normal. Yet despite this predictable biological reality, topics involving sexuality and masturbation among older adults continue to generate enormous curiosity and discussion. Scientific research provides fascinating insights into this subject. In 2010, researchers published results from a large U.S. population-based survey involving 5,865 men and women between the ages of 14 and 94. If we focus specifically on men aged 70 and older, the findings become very interesting. Among these older men, approximately 27.9% reported masturbating during the previous month, while 46.4% had masturbated at least once during the previous year. To understand these numbers better, it helps to compare them with younger age groups. Among men aged 25 to 29, about 68.6% had masturbated during the previous month, and 83.6% during the previous year. Clearly, masturbation becomes less common with age, but it certainly does not disappear. Another major study published in Norway in 2021 examined 4,160 men and women aged 18 to 89. Within that group, 342 men were over the age of 70. Researchers found very similar patterns. About 22.5% of men over 70 had masturbated during the previous month. However, one particularly surprising finding emerged from this study. Older men were actually among the most sexually active groups overall when broader sexual activity was considered. Researchers also discovered differences in frequency. Among men younger than 30, approximately 17.5% masturbated daily. Among men over 70, only 0.6% reported daily masturbation. This reflects a broader biological trend. Sexual frequency tends to decrease with age even when sexual interest remains present. A key question is whether masturbation in older men is directly linked to sexual desire. In 2020, a large meta-analysis published in European Urology Focus reviewed 75 different studies examining male sexuality across age groups. The findings showed that sexual desire does decline significantly with age, especially after 70. However, there was enormous variation between individuals. Among men aged 70 and older, anywhere from 16% to 80% still reported sexual interest. This wide range demonstrates an important truth. Aging affects people differently. Some men lose most of their sexual interest as they age, while others remain highly interested in intimacy and sexual activity well into their 70s, 80s, and beyond. At the same time, erectile function becomes less reliable with age. The same analysis found that erectile dysfunction becomes increasingly common in older men. Depending on the study, between 8% and 94% of men over 70 experienced erectile difficulties, with many studies clustering around roughly 70%. This can sound alarming, but there is another important detail many people overlook. Erection and orgasm are not the same thing. Orgasmic function can still occur even in the absence of a full erection. Many older men continue to experience sexual pleasure and orgasm despite having erectile dysfunction. Even more interesting is the psychological aspect. Younger men often experience tremendous anxiety and emotional distress when erectile dysfunction occurs. In older men, however, the emotional impact is often less severe. Studies show that while erectile dysfunction can certainly be frustrating, many older men become more accepting of physical changes over time. Among men between 60 and 70, up to 70% reported significant distress related to erectile dysfunction. Yet among men over 80, that number dropped to around 38%. This suggests that aging often changes perspectives on sexuality and performance. Emotional intimacy, companionship, and overall well-being may become more important than performance alone. Researchers are also learning that masturbation serves many purposes beyond simple sexual release. The Norwegian study found only a weak connection between masturbation frequency and overall sexual satisfaction. In other words, masturbation does not necessarily mean a person is dissatisfied with their sex life. Another large study involving more than 20,000 men found that many individuals masturbate for reasons unrelated to sexual desire alone. Some men use masturbation to reduce stress, anxiety, tension, or emotional distress. Others use it for relaxation, improve sleep, mood regulation, or simply because it remains part of their normal routine. This highlights an important reality. Human sexuality is complex. Sexual behavior is influenced by biology, psychology, emotions, relationships, health status, and social factors. Scientists still have much to learn about sexuality in older age groups. So what is the practical takeaway from all this research? Perhaps the most important concept is use it or lose it. Sexual function appears to benefit from continued activity. This does not necessarily mean intercourse alone. Sexual activity can include intimacy, stimulation, masturbation, or maintaining physical and emotional engagement with one's sexuality. Doctors who work with older men often encounter situations where patients become sexually inactive for many years and later begin new relationships through dating apps or companionship in later life. At that point, many discover that erectile function has deteriorated significantly. Unfortunately, restoring sexual function in advanced age is not always easy. Long periods of inactivity can contribute to structural changes in penile tissue and blood vessels. In some cases, these changes become difficult or impossible to fully reverse. This is why some experts believe regular sexual activity, including masturbation, may help preserve aspects of sexual function over time. Maintaining circulation, nerve stimulation, and tissue health may support long-term function, although aging itself will still naturally reduce performance to some degree. Importantly, masturbation itself is not harmful to health for most older men. In fact, it may provide several benefits, including stress reduction, improved mood, relaxation, better sleep, and maintenance of sexual responsiveness. However, this does not mean every older adult must remain sexually active. Declining interest in sex with age is perfectly normal as well. Some men remain highly interested in sexuality, while others lose interest almost completely. Both experiences are normal and healthy. The enormous variation between individuals is perhaps the most important message. There is no single correct level of sexual activity in older age. What matters most is personal comfort, well-being, and overall health. Many people also worry about the effects of sexual activity on the heart. Generally speaking, the cardiovascular risk associated with masturbation or sexual activity is low for most healthy individuals. However, men with known heart disease, severe cardiovascular conditions, or concerning symptoms should consult their physician for individualized advice. As always, this discussion is educational and not a substitute for medical care. Anyone with concerns about sexual function, erectile dysfunction, heart health, or medication safety should speak directly with a healthcare professional. Ultimately, sexuality does not simply disappear at age 70. While sexual function and desire often decline naturally, many older men continue to experience sexual interest, intimacy, pleasure, and masturbation as normal parts of life. Aging changes sexuality, but it does not erase it.